Hello everyone. Today I am going to discuss chapter 2 coding guidelines of neoplasm class 1. In this chapter we are going to learn what is neoplasm, what are the types, what are the treatments of the neoplasm and what is the sequencing of the neoplasm for a patient. So we will see the definition of the neoplasm. It is a abnormal growth of the cells. So whenever there will be abnormal growth of the cells, they will rapidly spread and damages the body or body part. So this neoplasm is of 5 types. What are those? We will see: malignant, benign, primary, secondary and metastasis. So in this image we can see these are the normal cells of the human body. So whenever this will become abnormal, so they will multiply like anything. See, we can see here it's been multiplying like anything. So this multiplication of the cells because of the abnormality, we'll call it as a neoplasm. So as a result of that, it won't stay in the same organ part, it will spread to other parts also. So this is the cycle of the neoplasm. We'll call it as a cancer also, or else tumor also. So we will see the types of the neoplasm. Malignant, it's a disease where the abnormal cell will destroy the body tissue and they will spread like anything uncontrollably. Benign, benign tumor, it won't spread to other parts of the body or else surrounding tissue. It's a tumor, both are the tumor. This will spreads like anything to the body tissue or surrounding part, whereas the benign will not spread to other parts of the body. And again we will see another types of the neoplasm. Primary neoplasm, it's nothing but the tumor from where it is been starting, that means to which part it is starting, in which organ it is been beginning. So the beginning part of the neoplasm, we'll call it as a primary neoplasm. Secondary neoplasm, so there will be multiplication of the neoplasm, right? That is, the abnormal cells will multiply from one cell to another organ part of the human body, right? So that spreading of the abnormal cells to other parts, so we'll call it as a secondary neoplasm. So here you can see spread to other parts of the body, we'll call it as a secondary neoplasm. So that spreading from primary to secondary, we'll call it as a metastasis neoplasm. Stasis is nothing but a spreading. So we will see the guidelines of the neoplasm. So the patient will have the neoplasm or malignancy, right? So suppose if the treatment is to the malignancy, so in those conditions for a patient we will give the principal diagnosis as the malignancy, to which site it is. As a result of the malignancy, patient will undergo treatment to cure the neoplasm or cancer, right? So we have some therapies to cure the neoplasm like chemotherapy, immunotherapy and external beam radiation. So whenever patient is coming for the treatment of these things like chemotherapy and immunotherapy, so in those conditions for a patient, first we have to give the principal diagnosis as Z51 and secondary as any problem or disease or the neoplasm as a secondary diagnosis. So we will see the Z51 ICD in the software. See Z51. So this is the subcategories of the Z51: encounter for radiation therapy, encounter for chemotherapy, immunotherapy. So we have to assign these ICDs whenever patient is coming for the treatment of the neoplasm, like he's coming for the treatment of the chemotherapy, right? So according to the ICD, particular ICD, we need to assign the Z51 and along with that we have to give the another any problem or disease or neoplasm as a secondary diagnosis. So there is spreading of the neoplasm, right? That is from primary to secondary, right? So whenever patient is admitting because of the primary neoplasm with metastasis to the secondary side and the treatment is to the secondary side, that is from primary to secondary it is spreading, and set to the secondary side there is treatment. Suppose primary neoplasm is to the breast, from breast to it is spreading to the lungs, think like that. So from breast to lungs it is spreading, but the physician is giving to the lungs only. So we have to assign the principal diagnosis as the secondary neoplasm of the lung as the principal diagnosis, and secondary diagnosis we have to give the primary malignancy of the breast. We will see in detail in the next coding guidelines. So in order to understand clearly, we will see one scenario. Patient admitted because of the primary neoplasm of the colon cancer with metastasis to liver, which is the secondary side, and treatment is to the secondary side. So how to code? Here in this scenario, patient is having two types of neoplasm. One is colon and another is liver. So from colon it is being spread to the liver, right? So but the treatment is only to the secondary side. So as per the coding guideline here, treatment if it is to the secondary side, so principal diagnosis should be the secondary side, and then the secondary diagnosis should be the this one, primary neoplasm of the colon cancer. So whenever the treatment is to the secondary side, so principal diagnosis should be the secondary side, that is liver. So we will see the ICD for that. Secondary neoplasm of liver. The ICD is for this is C, secondary malignant neoplasm of the liver. C78.7 is the ICD. C78.7 is the ICD, and then this is the principal diagnosis, and the secondary diagnosis would be primary neoplasm of the colon cancer. So for this we have a ICD, that is it is not mentioned as a ascending colon, transverse colon, nothing is mentioned. So it is an unspecified, that is malignant neoplasm of the colon unspecified. It is C18.9. C18.9 is the ICD for this. So whenever a patient is admitted because of the spreading of the primary neoplasm to secondary side and the treatment is to the secondary side, so in those conditions first the principal diagnosis would be the secondary side, and the secondary diagnosis should be the primary neoplasm of whatever it is. Next we will see the coding and sequencing of the complications. So for the neoplasm conditions, patient will have some complications. So how to code those complications with the neoplasm we will see in detail. One of the complication is anemia associated with malignancy. So whenever patient is getting admitted for the anemia which is associated with the malignancy, so in those conditions and the treatment is only to the anemia, so in those we have to give the principal diagnosis as malignancy first, and then secondary we have to give the anemia. So simple anemia code we should not give, we have a combination code for that, that is anemia in neoplastic disease, that is D63.0. So whenever patients who is having the neoplasm along with that anemia is also there and the treatment is only to the anemia, so in those conditions we have to give the principal diagnosis as malignancy and secondary as a anemia. So in order to understand clearly, we will see one scenario. Patient coming with anemia and malignant neoplasm of upper lobe, right bronchus or lung, and patient getting treatment for anemia. So how to code? So as per the guideline here, patient is admitted for the anemia and he is also having the neoplasm malignancy and the treatment is to the anemia. So first what we have to give, as per the guideline, first we have to give the malignancy. So that is, here we can see the malignancy site is to the upper lobe of the lung. So we are going to the software and we will assign the ICD for this. So this will be my principal diagnosis: malignant neoplasm of the upper lobe, right bronchus or lung, that is C34 dot level will be the ICD. C34 dot level will be the ICD, and my secondary diagnosis would be D63 dot 0, that is anemia in neoplastic diseases. So we have any clarification, you can also check in the software D63.0. So like that, see, anemia in the neoplastic diseases. So like that we have to give the ICDs for a anemia and malignant patient. So whenever the treatment is to the anemia and then patient is also having malignancy, we have to assign the sequence like this. Suppose anemia associated with the chemotherapy, immunotherapy and radiation therapy, whenever patient is having these conditions, so how to code that we will see here. So whenever patient is getting admitted for anemia, he is also having adverse effect of the immunotherapy, chemotherapy, and the treatment is only for the anemia. So in those conditions, first we have to assign the principal diagnosis as anemia and the secondary diagnosis would be the neoplasm, and then the adverse effect of the anti-neoplastic drugs or immunosuppressive drugs. So here adverse effect is nothing but, so whenever the cancer patient will receive this kind of treatment to cure the neoplasm, right, so they will have some adverse effect. It's nothing but a side effect. So in those conditions, whenever the patient is encountering, so and the treatment is only for the anemia, whenever he is also having the anemia, so in those conditions the sequencing would be like this: first anemia, then neoplasm, then the adverse effect of the neoplastic drugs. So in order to understand clearly, we will see one scenario: patient coming with anemia having colon neoplasm associated with the adverse effect of the chemotherapy, and the treatment is to the anemia. So how to code this? As I have explained, first we have to give the anemia code, that is D63.0, that is anemia in the neoplastic disease, and then we have to give the neoplasm code, that is colon neoplasm. So what is the ICD for the colon neoplasm? We will see. It's nothing mentioned, so we have to give the unspecified, that is malignant neoplasm of the colon C18.9. We have different benign, malignant, so nothing is mentioned, so I am giving this C18.9 as the secondary diagnosis, that is C18.9. and then finally which ICD we have to give, that is adverse effect. Because of those treatment he is having the adverse effect, so I am going to assign T45.1x5 as the secondary diagnosis. So in order to understand clearly, we will see in the software here. So this is nothing but the adverse effect ICD. This is a complication code: adverse effect of the anti-neoplastic and immunosuppressive drugs. So like that we have to sequence the ICDs whenever patient is having adverse effect of the chemotherapy, and along with that he is having anemia and neoplasm, and treatment is only to the anemia. So this is the sequencing. So whenever patient is admitting for treatment of the anemia as well as the neoplasm, and suppose patient is having adverse effect of the radiotherapy, so in those conditions how to code we will see. So first we have to give the anemia as the principal diagnosis, then the neoplasm, similarly like in the previous one how we have seen in the chemotherapy, immunotherapy, similar to that only. But here in this we are not going to give the T series, that is a complication series, but we are going to give the Y84.2 ICD, that is radiological procedure and radiation therapy as the cause of the complication. So similar to this guideline only, but instead of this one we are going to give Y84.2 ICD, that is because of the radiation therapy as abnormal cause, that one we have to give as the secondary diagnosis. So we will see the remaining guidelines. Management of dehydration due to the malignancy. So in the neoplasm patient will be getting dehydrated continuously. So when the patients are coming to the hospital because of the dehydration from the malignancy. So how to code that we will see. So patient is coming for the treatment of the dehydration because of the malignancy, and the patient is receiving treatment only to the dehydration. So first we have to code the dehydration as the principal diagnosis and malignancy as the secondary diagnosis. Simple this one. So in order to understand clearly, we will see one scenario. So here patient is coming with dehydration because of the neoplasm, and treatment is to the dehydration only. So how to code we will see. So as patient is having dehydration, treatment to that, to which the treatment is, we have to code that as a principal diagnosis. So dehydration ICD we will see here. So dehydration ICD is, one second, think the software is slow. The dehydration ICD would be E86.0. So the ICD is E86.0, and then we have to give the neoplasm ICD also, right? So colon neoplasm ICD is, we have seen previously, it's malignant neoplasm of colon unspecified, that is C18.9. So C18.9 we have to give. So like this we have to give the sequencing for a patient who is dehydrated because of the neoplasm, and the treatment is to the dehydration only. We will see another guideline: treatment of a complication resulting from a surgical procedure. So the neoplasm patients may undergo some surgery. So whenever that surgery has led to some complication and the patient is coming to the hospital for the treatment of that complication, so in those conditions the principal diagnosis would be the complication of the surgery as the principal diagnosis. So whenever we have seen that primary and secondary neoplasms, right? So whenever the primary malignancy is removed, so for the neoplasm patients, the doctors will perform the surgeries and they will remove the neoplasm. So whenever the primary neoplasm is excised or removed from its site or from other region, so and there is no treatment to that side and no evidence of any existing primary malignancy, so in those conditions we have to give only one ICD, that is Z85, as a personal history of the malignant neoplasm. Personal history we have to give. Why I am saying history? Because there is no malignancy, there is no primary site, there is no treatment to that patient. So in those conditions we have to give Z85 as the ICD. So we will see in the software Z85. See, this is the personal history of the malignant neoplasm. So whenever the primary site is excised or removed and there is no further treatment and there is nothing in that, so in those conditions we have to give this one. And in this we have different subcategories, to which side it is, to which organ system. So like that, according to the documentation we need to check clearly and we need to give the particular ICD for it. So in this cases we have to give like this. So whenever that primary site is metastasized to another site, that is the secondary malignant neoplasm site. So here in the image we can see, suppose think that this colon location is a primary cancer. So it is starting from here. So whenever the starting point is set, so that one we will call it as a primary cancer, right? And this is spreading to the liver and lungs. So it is metastasizing. Metastasis is nothing but spreading to liver and the lungs, right? So and this has been removed. This colon cancer is removed and the treatment is to the liver and the lungs. So in those conditions we have to give the principal diagnosis as secondary site, and this exercise primary site we have to give as a personal history, that is Z85 series. So in this image we can see clearly the primary site location of the cancer and the secondary location of the cancer. So whenever treatment is to whatever, if treatment is the primary, we have to assign that as the PDX, and treatment is to the secondary, we have to assign in this way. And if the primary site is exercised, so we have to give that as a Z85. If still it is there, we have to give that as a present, and present as a secondary diagnosis according to the coding guidelines. So in order to understand clearly, we will see one scenario. Patient coming to the hospital with primary neoplasm of stomach is removed with metastasis to lung. So how to code this? So in this scenario we can see that patient had stomach neoplasm and that is removed, so no further, it is not at all there, and it is been metastasized to liver. Metastasis is nothing but the secondary neoplasm of the liver. It's been spread from stomach to liver. So metastasis is nothing but spreading, right? So spreading to the liver. So that will be the secondary neoplasm of the liver. So there is no primary neoplasm further, so that one will call it as that one will call it as a secondary, and the secondary neoplasm is still present and the treatment is to that only. So first we have to assign the principal diagnosis as the secondary neoplasm of the lung. So my principal diagnosis will be secondary neoplasm of, sorry, liver, it's liver. So my principal diagnosis will be C78.7. C78.7 will be the principal diagnosis, and then we have to assign Z85 as per the guideline. As I have told that if no further primary is there or removed, so we have to give that as a Z series, that is Z85 series. So it is related to stomach, right? And one more thing also I have told that if you'll go to this series, we have specific organ locations, digestive. So stomach is to the digestive. So if we'll go to this sequence, we will get the personal history of the malignant neoplasm of the stomach, that is Z85.02. So my secondary diagnosis will be Z85.02. So like that we have to assign the ICDs whenever the primary is removed and no further treatment is there, but it's been spread to liver and the treatment is to the secondary side. So in this way we have to assign the principal diagnosis as the secondary neoplasm of the liver, and then the secondary diagnosis will be the personal history of the primary site. So these are the coding guidelines of the neoplasm. We will see another guidelines in the next session. If you have any queries, please comment below.